All right. So we're here to talk about Lyme disease, and I'm on my lime green wall. I did a video last year because I learned from Kelly so much about Lyme disease. I was unaware, and a lot of my subscribers they garden, they live near the woods, they're outdoorsy, or they're parents. So I think it's really important to go ahead and talk about this and talk about what I didn't know. And Kelly is an expert, and we're just gonna talk about it. So the most important thing I think you should know, if you don't, is Lyme disease is spread by ticks.
Mm-hmm.
Okay?
Yes.
Tell us about Lyme disease a little bit, Kelly.
Okay, yes. Ticks is the most common way that it is spread. It can be spread other ways too. So what I really want people to understand is that most people don't know how bad Lyme disease can get. I think a lot of the misconception is that it's just something you'll get over in 2 weeks. And that actually doesn't happen for a lot of people. You can get it and be sick for years and years and years. You could never see a tick. Like, what if it's in your hair and you never saw it? I have dark hair. Maybe it gives you a bullseye rash you can't see in your hair. So a lot of people start having strange symptoms and they have no idea what's going on. They have no idea they have Lyme disease. The doctors are not all informed about it. So when they're testing for different things, they don't even think to test for Lyme disease. And, a lot of people go undiagnosed. So I really want to get prevention is the key, because once you get it, it can be hard to get rid of. And I really want people to be aware of how to get it, how important it is to protect yourself, and how bad it can get, because most people don't realize that.
Yeah. Great. So can we start at the beginning?
Yes.
If you find a tick on you, what do you do?
Okay, so the first thing you want to do is get some tweezers. Try to get as close to the head as possible. You want to get that head out of there. So I got one off my son a few months ago. Especially if it's engorged, if it's bigger, what you want to save the tick. Do not get rid of it. Get out a plastic bag. Get out a cotton ball, get the cotton ball wet, get it a little bit moist, save the tick. This way, if you develop either a bullseye rash, which is the clinical definition of to know you have Lyme disease, it's actually CDC positive if you have a bullseye rash, save it in here with a moist cotton ball, put it in the refrigerator. If it's already engorged, like if it's already sucked some blood, there are places you can send it to, labs. They will test the actual tick, and they can test if the tick has Lyme disease or there are other tick illnesses besides Lyme disease. If the tick has any of those in it, then they know that it had it in it when it was putting it in you. When my son had a tick on him a few months ago, I had gotten it out. It had probably just attached. It hadn't started feeding. So for him, I didn't send it to a lab. I just left it in the refrigerator, and I waited to see if he had any symptoms or got a rash, and he never did. So, if it hasn't started sucking your blood, then maybe just save it in case something happens. But make sure you save it. That's important. It gives you a lot of information if you actually save the tick.
Now tell me, do you always get a bullseye rash?
No. Some people get a rash that doesn't look exactly like a bullseye. Maybe it just looks red and there's no bullseye. Some people don't get it at all, or maybe it's somewhere like your hair and you never see it, or you don't know. So you definitely don't always get a bullseye rash, and that's the hardest when you don't know.
So here's a little image. I'm not sure. Is that showing up okay?
Yes.
Okay, so that's what a bullseye rash is going to look like. But if you don't get a rash and you did have a tick on you, what other symptoms can you look for in yourself?
Okay, yeah, and I'm gonna it literally looks like a bullseye. The hardest part about Lyme disease is it affects so many different parts of the body. So there can be lots and lots of things. One of the most common, definitely joint pain, headaches, extreme tiredness, like more than just you didn't get, enough sleep. Those are some of the most common. It causes neurological damage. So anything neurological, if you have like little ticks or jerking or like a lot, think of diseases like maybe Parkinson's where the person can't control their things like that, since it is neurological. Yeah, and since it's neurological, wow, it affects your eyes, your hearing, your sense of smell, things like that too. So those are some of the things to look for.
So would you share with us why you're an expert and, what is your experience with Lyme disease?
Okay, so my daughter has had Lyme disease for the past 9 years. Actually, end of May, 9 years ago, was when we discovered a bullseye rash. Never saw a tick, but she had like the classic clear bullseye. I did know some people who had Lyme, so we got to see one of the top doctors right away, who luckily told me, when you have the bullseye rash, it is Lyme disease. So many people told me we were lucky we knew when I first got it, which I didn't understand. We're not lucky, but knowing is half the battle. So of course, when your own child has something, you become an expert, you read everything. Plus we've been experiencing it for 9 years. I have to say it's been a tough 9 years. It's been some really hard times. It's, been hard to see her suffer with it. And yeah, she's had some really, really bad symptoms. So yes. So that's why I'm an expert.
And what would you say is the most important thing to do if you see you have a bullseye rash? What's your first step?
Okay, well, hopefully you saved the tick, but maybe if you never saw a tick like us, go to the doctor. I know it's hard right now, but the number one, before you spend a lot of money on a Lyme literate doctor, get doxycycline. It is an antibiotic. They usually won't give it to children under 13 because it can make your teeth turn yellow. My advice, knowing what I know now, wishing I knew then, get it for your child who's under 13, because believe me, it is so much easier to fix yellow teeth than to get over Lyme disease. Believe me. Yeah, just get that.
So if your doctor tries to say no, you can push and you can get it.
Yeah, push, do what you got to do. Go to a different doctor. I know we can't travel right now. Trust me, go to Mexico. It's cheaper to go to Mexico than to pay for Lyme disease treatment. Believe me on that one. Yeah.
I think that's really important because a lot of times you want to listen to your doctor. You think they know, but Lyme disease is kind of a gray area with doctors.
Mm-hmm. Mainstream doctors are not informed in how it works. There's a lot of controversy and disagreement in the medical community with mainstream doctors with treatment and how it works. If you get chronic Lyme and Lyme gets to the bad state, you need aggressive treatment. And a lot of doctors don't agree with aggressive treatment, number one. Number two, the CDC says you only need a few weeks of antibiotics and you're cured. So if the CDC isn't even lining up with Lyme, that makes it really hard for Lyme patients and Lyme doctors who are trying to treat. I mean, I have my own story with my own doctor, which I'll get into later. Yeah, so
it's important to be your own advocate when it comes to Lyme disease.
Absolutely, because
so you know about this.
Right.
Doxycycline.
Yes, there's just a lot of misinformation, even among doctors. So you do have to do your own research. You have to be your own advocate. If a doctor doesn't believe you, go to a different one.
Very good to know, because doxycycline isn't just any antibiotic, right? It's the strongest. Is that what it is?
It's the one that works for Lyme disease. just the way that Lyme works. It's the one that works. And if you get it right, if you get to taking doxycycline right away, you can get cured. And there is a percentage of people, if you get it right away and you get on 3 weeks, there are people who are completely cured and never have to worry about it again. So that's your best chance. Yes.
Great. I know your daughter experienced some very scary symptoms with Lyme disease. Would you mind sharing a little bit about that?
Yes. The worst was when she lost her ability to walk. Like, this one's hard for me to talk about. Like, she couldn't feel her legs from the waist down. And for a week, and then another 2 weeks, but not 2 weeks in a row, she couldn't walk. Like, she was paralyzed. And that was the worst. That was the worst it ever got. Yeah.
And she is doing really well, but she still has chronic fatigue. Is that right?
Yeah, she actually, for the first time in, I would say 5 years, she stopped going to school 5 years ago. So for the first time this past January, she went to school full time, which was awesome. And she was doing great. She was going to school all day and then would still have energy for other things. I'd say she's starting to go backwards a little bit, but she's still doing better overall. So things are starting to look better for us. We've been lax on the treatment because we're afraid to now go to the doctor with what's going on. There's other doctors in that same office. You know, I don't want her to get coronavirus. So yeah, that's what's going on right now.
Well, that's so good that she's been improving, and I'm sure being home is kind of, it's setting us all back a little just mentally,
Yeah.
Hopefully
Yeah.
she can get back into the swing of school.
Yeah, and she spent years just in her room by herself because she was too sick to go anywhere. So she spent years, and she's finally able to do normal things. Like, you take for granted when your kids can do normal things, go to a friend's house, go to the movie with their friend, go to a football game at the school. She was starting to do those things, and it was like looking up again. I'm going to, while you ask the next question, I'm going to look at some of the chat questions.
Yes, please. And I was going to ask you, when you went to the doctor with her, this is a common thing. The doctor accused her of faking it, of faking her symptoms because she didn't have physical symptoms, right?
Okay, yeah. That specifically for us, so when she couldn't walk, our doctors sent us to a neurologist. Lyme doctors can be accused of things. So I think they want to send you to make sure it's nothing else, just to be sure. And that doctor brought me in another room and told me that she was faking it. And yeah, and I was with her every single minute because she couldn't move her legs. So I was with her all the time. I would have known if she was faking it. Like, I would have seen her maybe like walk a little when I wasn't looking or something. But it is common, like, when people are having all the symptoms and they don't know that they're having Lyme disease, they'll get tested for all these other kinds of things that'll come up negative, and then the doctor will tell them they're faking it. It's like the doctor doesn't want to be wrong, so he's going to put it back on you. Must be something wrong with you. You're faking it, or it's psychological. It's all in your head. It's all in your brain, So yeah, that is a common thing that people with Lyme disease experience. So you're suffering from the disease and all these symptoms, and then you're being told by doctors that you're faking it, or family members too. Yeah.
Right. So that just, if there's anybody out there and you have symptoms and you haven't been diagnosed, you're not alone, and this, it could be this. So I'm hoping we're reaching someone today. I'm looking at the chat for you, and Mindy is asking, how old was your daughter when she first got it?
She was 6 years old, and now she's almost 15. So yes, 9 years. And I also was reading, Mindy said, my daughter had it and went to a specialist, figured out she had to have a specialized test of blood and be on doxycycline for a year. How is she doing now, Mindy? Do you feel like she's cured? Does she have any other lingering symptoms? And what was the blood test she had? Was it the Western blot or which one was it? So yeah.
And
So those
hello
are,
to everybody in the chat. Thank you, Cindy. Thank you, Tim. Thank you, Casey. Thank you, Cindy Plummer. Appreciate you guys being here.
thank you, everyone.
Do you want to talk a little bit about prevention?
Yes. Okay. So several things you can do. Okay. So for your skin, there are bug sprays. So I like to use the main ingredient actually in both of these two bug sprays is Pickardin. Consumer Reports rated it better even than DEET. Most people use DEET, and DEET is the most common, but Pickardin was rated even better, and it is less toxic. I'm going to write that in the chat.
Okay, perfect.
Yeah. And
I can't spell it. Pickardin, okay? Because some people don't like DEET. A lot of people that I know are very natural. So last year I used the lemon eucalyptus, and that's also highly rated, correct?
yes, that was on Consumer Reports top list for, so actually Pickardin, DEET was on there. I think DEET came after Pickardin. So Pickardin's better and less toxic. And then the lemon eucalyptus is an all natural one. Usually it comes in a smaller bottle. It's hard to spray your whole body. That's why I prefer this one. DEET is, DEET's only good on your skin, won't work on your clothes. Pickardin can work on your skin and clothes. It's a repellent on your clothes. Now, there's also permethrin. You have some, yeah, we buy that one too. You have this, so she has the straight chemical, and then we usually use that and mix it with water, do our own mix. And this is for clothes. You don't put this on your skin. It won't do anything on your skin. Dogs too. Look at your, if your dog has a collar or flea and tick prevention, most likely permethrin is going to be one of the main ingredients. So I just take this and spray it on my dog, spray it on my clothes. So one thing that this does is it kills the tick, not repels. It actually kills it, and kills a lot of other bugs too. Actually, lice, main ingredient, permethrin, if you look at lice shampoo. So it kills a lot of, we'll bring this to a hotel and spray underneath the bed in case they have bed bugs. So this kills like a lot, it kills bed bugs, ticks, lice, a lot of different bugs. So if you actually soak your clothes in it, it lasts even through washing. So you can wash your clothes and still wear it. The permethrin will stay. Put permethrin on your shoes. Then like you're walking
Socks.
in the woods. Yeah, socks, anything that, so then when it starts walking, it gets killed before it gets high enough to get on your skin. So this is actually like a better prevention than even just putting stuff on your skin. Having it, the ticks killed, having it on your clothes. So, but again, this is toxic on your skin. Don't put this on your skin. Usually I spray it on my clothes.
Toxic to cats too.
Yes,
right?
Cats. Yep, toxic to cats.
So tell me how to do it. Do I just do it right here on my clothes, or?
No, don't do it while you're wearing your clothes. Like take your clothes outside, spray it on your clothes, leave your clothes outside for like 2 hours and let them wear out, because this is toxic to people. So pre-spray your clothes. You can buy, let me see if I can find a picture, because if you don't want to like buy the straight chemical and spray it yourself, there's things that you can buy like at Walmart, sprays that are like already mixed for you. I'll see if I can find a picture on my phone.
Okay. And this, I'll just let people know, I got this at Tractor Supply. It was $7. And this is last season I made a bottle. I probably made it too strong, but you said it's 1 to 20, water 21 permethrin.
Yeah.
Right?
Yes. Right. So yeah, that's exactly the bottle that she has is what I use to make this. So yes.
So that'll last a long time. And I did spray my dogs because one of them comes inside. And after I talked to you, I found a tick in my daughter's bed. And that was it. I just freaked out. I said, I've got to get this cat out of my house. And the cat has since not come in. And just last week, I was planting trees and I had a tick on my back. And it didn't get engorged. It just bit me once and I got it off. And I tried to save it. And I think the dogs took off with the bag or something. But I had that spot that was itchy. And, you know, it's just so good to be aware and be watching for that bullseye rash and just,
Mm-hmm.
you know, check your children, put them in the bath after they've been outside. And my son said, can we go for a walk in the woods? And last year I would have said, yeah, let's go. And this time I was like, you know, we'd have to put on our clothes and I'd want to get them sprayed. So we'd have to prepare.
Mm-hmm.
So
Yeah.
I was just so unaware. And I'm so glad now that, you know, you shocked me into realizing that it's not a joke. It's not just like any other bite. It's can be a lifetime thing. So thank you.
Yes, yes. Well, I'm glad. I'm glad I hopefully prevented you from the pain that our family has gone through. And yeah, it's that important. It's that important. Seriously, I want everybody to know this. If you let your kids out in the woods without protection, without bug spray, without permethrin, you're playing Russian roulette with their lives. So, yeah.
We have a question in the chat from Heather. She said, I have a question that I haven't been able to find the answer for. If you already have Lyme disease and get bitten by another Lyme-infected tick, can you get reinfected or do your symptoms get worse?
You can get reinfected. Yes. Yes. Like with my daughter, with her having it for so long and symptoms not going away, my doctor kept asking us, has she gotten reinfected? Has she had any bites you know about? You could definitely get reinfected. I also want to talk about symptoms getting worse. I know this wasn't exactly Heather's question, but yeah, if Lyme goes untreated, the symptoms get worse too. There's a lot of similarities between Lyme and AIDS. So, you know, like AIDS, the T cells, they keep multiplying. If, you know, the same with Lyme, like if it doesn't get treated, it keeps multiplying, it keeps getting worse, your symptoms get worse, you'll get a worse case of it. So that's why, like, if you do get it, the sooner you can get treatment, the sooner you can, you know, start treating it, the better, or else it just gets harder and harder to get rid of. It hides too. It hides in your joints. It hides, you know, it can hide in your brain. It hides in different parts of the body and keeps multiplying. So, yes.
So being on top of things and being quick and paying close attention is very important.
Yes. And okay, and Mindy responded to me. It took us a lot of specialist appointments to figure out what was wrong with her. She was tired all the time. It was a neurologist after doing a lot of testing that sent her to the Lyme specialist. Well, that is awesome that your neurologist is the one that sent her, because I told you about our neurologist thought she was faking it. Some neurologists like don't believe or know enough about Lyme disease. Mindy, I think you've told me before, but I forgot. What state are you in? Heather, what about Epstein-Barr virus? Any similarities? Yes, that's one of the many diseases people can get misdiagnosed with. There's so many diseases that imitate Lyme, or Lyme imitates them. Some of them I actually believe are Lyme, and some I just think are similar and they get mixed up with Lyme. So yes. I mean, do you want to know some of the diseases people get misdiagnosed? Okay, yeah. Definitely RA. I had a friend who got misdiagnosed with RA. I have another friend who actually has RA, and like her hands curl and get out of joint. And this other friend who actually had Lyme disease didn't have the same thing happening with her hands. Parkinson's, you know, things that make you go, because, you know, not Michael Jackson, Michael J. Fox, he actually was seen on a few years ago on one of the late shows saying he got bitten by a tick. So, yeah. And ALS I actually believe ALS is Lyme disease. The book I'm reading about how Lyme started, the man who kind of discovered it was working with ALS patients, then started working with Lyme patients, and he noticed a lot of similarities. But there can be so many. People get misdiagnosed with like mono, chronic fatigue, I already said RA, or junior rheumatoid arthritis. Fibromyalgia. Fibromyalgia is one of those mystery diseases. No one knows how it starts or what causes it. It's basically diagnosing the symptoms. MS. I mean, I told you my daughter lost her ability to walk. People with MS lose their ability to walk. So those are just some of them. Yeah.
And we forgot to mention that you can go get tested for Lyme and get a negative test, and there's a lot of false negatives.
Yes. See, I'm seeing a lot of similarities with the coronavirus, the false negatives on the test, the malaria drug. Malaria drugs are used to, and azithromycin is also one of the drugs that used with coronavirus. Azithromycin, my daughter's been on it. So anyways, you can get a test and the test can come up negative. So basically there's 5 bands on the test. All 5 of them have to come up positive in order for the CDC to recognize that it's positive. But really, if you have just one, like, you have it. And that was actually one of the problems that my doctor was having, or one of the things used against her in court against the medical board. But yeah, so basically, if you get a positive test, you definitely have Lyme disease. If you get a negative test, all that means is you may or may not have. It doesn't really mean anything. You may or may not have it. So
can you go ahead and do the doxycycline if you feel like you have all these symptoms? Do you think it's harmful? I know you're not a doctor, but in your opinion, can you go ahead and just do that to be sure and like try to?
I would. I don't know if a doctor would give it to you. I would definitely consult a doctor on that one. If you can find a Lyme specialist. Lyme specialists are awesome, but they cost a lot of money and they do not take insurance because of the CDC guidelines. So I wouldn't go until you're 100% sure that you have it. But yeah, if maybe a Lyme specialist would know to start you on Doxy or something else.
Okay.
Yeah.
All right. Did we cover everything? Trying to think. Oh, Mindy, there's some more things in the chat. So Mindy said they are in Texas, but they moved from Illinois. She thinks she got it in Illinois. So many trail rides on her horse. She was diagnosed after we moved to Texas.
Oh, yeah.
She was around 20 years old, so she could communicate with us about what was going on. She was away at college, so of course we thought she was just goofing off at college. Oh.
Yeah.
That's so hard.
I know, it's common. And you weren't there to see her. And that's common that, parents think that, or, it's been hard for me. Like, I feel like I understand more than anybody else in her life, but she still tells me I don't totally understand. Like, I'm not inside her body to feel the symptoms. But yeah, horses, people who ride horses is a pretty common way to get it. Yes, a lot of people who ride horses.
Is it in all states? Because I've had people tell me, well, I live in so-and-so state and we don't have Lyme disease.
Right. It isn't, I think, except for Hawaii. I'll have to double check on that. I know at least a year ago there was none in Hawaii. It is in all states. And the most worrisome thing is when doctors say, like, oh, we don't have it in our state, it can't be there. I mean, come on. When ticks are walking through the woods, they don't say, oh, can't walk there, can't walk to that state. Yeah. It's don't let a doctor tell you there's none in your state. Go somewhere else if they say that, because then they're very misinformed. Yeah. It's in at least
the deer tick.
Yeah.
You said all ticks can carry a lot of diseases, but the deer tick is the most worrisome. Is that correct?
That's the one most common for carrying Lyme disease. But with travel, it can really be any tick. Because imagine if a tick with Lyme bit someone and then another tick bit that person, then that tick would have Lyme. I have a little chart here if you can see, but there's different kinds of ticks and like the different things they can carry. I mean, there's other things besides Lyme disease that you can get from a tick. And some ticks can give you more than one disease, right? So there's other, you can get Bartonella, Babesia, Rocky Mountain spotted fever. You can get like a meat allergy. That's been one that's, so yeah, there's other, so sometimes they can transmit more than one thing. And I definitely think my daughter has had more than one thing. Yeah. Bartonella, you can also get, also called cat scratch disease, you can get from cats and dogs in addition to ticks. But it literally looks like an animal scratched you, the rashes that you get. She had one, still does a little bit, or it's faded, but she looked like a bear clawed her on the back. So if you have like rashes like that look like somebody scratched you, that could be Bartonella, which is another tick disease. So yeah, there's other things you can get from a tick besides Lyme disease. Yeah.
Well, I know a lot of people get it in the armpit and they won't notice because maybe that's a place that you don't see. So it's important to shower, right? I mean, shower every night if you're outside.
Right,
Check
especially,
yourself.
yeah, if you go in the woods, come in and shower right away, especially if you're in like a high tick area, tall grass or woods. So yeah, definitely.
And you can spray, I think you can spray permethrin on your property, but I just have too much property to even think about doing that.
Yeah.
But we have a lot here. I see them way too often. So I think this is really important for me to get this reminder too. You know, and after that one bit me and it was itching, and I just thought, you know, most things when they bite you, they don't continue to itch. And,
Right.
you know.
Yeah, I see a question in the chat. Kelly, can Lyme disease pass from one person to another? Okay, so yes, but not in the same way like a respiratory disease. Like I'm not going to get Lyme disease just from being around my daughter, but it is a blood-borne illness like AIDS. So you can get it, you know, the same types of way, a blood transfusion. Mother can pass it to their daughter in utero, or you know, don't share like razors or anything that could pass blood with someone with Lyme disease. Yes, so there are other ways. Of course, the tick is the most common. So, yes.
Can you show that photo again? I really wanted to get a look and get everybody to get a look at that. They're hideous creatures,
I
but
know.
all right, right there is perfect. The third one down, I think, is the one, either that or the fourth is the one that I had.
The spotted
Yes.
one.
Yes.
Yeah.
So again, if you find one and you want to send it in, you put it in a plastic bag with a slightly wet cotton ball, seal
Yes.
it up.
Mm-hmm.
Okay.
And then send it to some place that's actually going to test the blood inside the tick, because my own mother made this mistake. All they did was just identify what type of tick it is, and that's not what you want. You don't want them to say, oh, that's a, okay, that is a, you want them to actually test what the tick has. This tick that you were saying you think was yours was the American dog tick.
Mm, I do
So,
have 4 of those. So
yeah.
I just got them their flea and tick medicine too, which sometimes I slack on that, but now I'm going to help them help me.
Yes, especially in the spring. There's a reason May is Lyme Disease Awareness Month. That's when the tiniest little ticks, the larvae, look how they can be as small as a poppy seed on like a muffin. And those are the ones that are more dangerous to carry Lyme disease, and you really can't see. The CDC posted like a muffin, a poppy seed muffin, and it said, I bet you can't tell which one was a tick. And it got people like mad, which, come on, people, they needed to make that point. They needed, you know what's going to make you more mad is if you or one of your family members gets Lyme disease. So I think it was a good point that they made to show you, like, you can't, they're so tiny, you can't always see them. That's why you've got to take these measures to prevent. You may not always see it. Yeah.
Right. And I always thought, like with a lot of diseases, if you get a disease, then you just go get a cure for it. But this isn't something that there's a for sure cure for. So you have to be on the lookout.
Yeah, it's not easy to cure. The best thing to do is prevent it from happening in the first place. Let's see, okay. Mindy said her test was positive for an angioplasma, which are tick related. She did not show positive for Lyme, but because she had the other two, the doctor felt it was a false negative. That's good that you had a doctor that was informed, Mindy, because a lot of people would get that and the doctor would say, no, you don't have it, no way. And then they go on more years suffering. Casey said, in the area I lived in Germany, there are over 2,000 cases every year. Yeah. Actually, there's a top Lyme doctor in Germany. We'll go see. Okay. Yeah. So
hunters, people that are out there in the woods, sitting
yeah.
in a deer stand, and so the spray, I think this permethrin spray has to be the best thing I learned from you last year, because if it's going to land on my clothes and it's going to die, that's number one,
Mm-hmm. Yeah, and if
because
you're
this one
hunting,
went inside my shirt,
oh
and
yeah,
if I had had my shirt sprayed, it would have killed it and it never would have bit me.
right, exactly. And it actually kills instead of just repelling like your spray. So yeah, if you're a hunter, spray all your hunting clothes. If you're going camping, like last year we saw a tick crawling on the tent. We sprayed the whole tent. Spray your equipment, your tent, your sleeping bag, all your stuff, all your clothes, especially if you're going somewhere where you're going to be around. And yeah, and don't think because you're in the city that you're immune. They're starting to come more and more, out in the cities too. So
Right. And city folk might go on a hike and not even think about it because they're just not, not thinking about it. So everybody needs to be informed. And thank you so much for helping me and coming on my channel. And if someone watches this, and comment below and tell us if we helped you, because that's our goal, is really just to help other people. And I really appreciate it, Kelly.
yeah, sure.
You want to go over it? So remove with tweezers. Make sure to get the head if it is engorged in your skin. You told me something about alcohol, rubbing alcohol.
Oh, yes. Two things we almost forgot to tell people. Rubbing alcohol or Vaseline, a lot of people, these are some myths. A lot of people think that you put the Vaseline, it causes the tick to get out of your skin, and it does, but here's the problem. It causes the tick to regurgitate, and so if the tick has Lyme disease or something, it's going to throw that back into you. So you actually don't want to use this because you don't want the tick to regurgitate back into your skin when you use this. It's better to just use the tweezers. Some people use alcohol too. So, we forgot the misconceptions. One more misconception I wanted to tell people. So the information that's out there is that the tick has to be on you for like 36 hours, 3 days or something. It doesn't. I mean, it's more likely to infect you if it is, but I've heard so many stories of people who only had a tick on for like 15 minutes or something small. Don't think that just because it wasn't on for a long period of time that you're clear. Yeah, you're not. So that's another myth.
Right. I looked it up.
Yeah.
And I thought, and it said, okay, well, it wasn't in my skin and it was only on me for like 15, 20 minutes. And according to the internet, I didn't have anything to worry about.
Right. Yeah. Don't think you're out of the clear. I mean, if it's engorged, yeah, then you need to keep an eye out on it. So,
Okay.
yeah.
All right. And you can but you can push for it, and you would have if you had it to do again.
Yeah,
You would have
Danny,
pushed.
I don't know why my screen froze, so I didn't hear like the past few minutes of what things that you said.
Oh
Yeah.
no. I just said if anybody had any questions, if somebody's watching this and they're not sure, drop a comment or send me an email if you want to be private. My email is below. We want to help anybody who has questions. And okay, so get a spray that has Pickardin. It's better than DEET.
Mm-hmm.
And you can also use the natural lemon eucalyptus, and then you can spray your clothes with permethrin, and you dilute it,
Mm-hmm.
120, and take a bath and wash and check your children, and just be extra careful to the point where someone in your family thinks you're being a little over the top, then you're doing good, right?
Yes, yeah, let them think that. I mean, maybe think twice when they say go on a walk in the woods. Why don't we go on a walk somewhere else? It's that pertinent. It is something you need to worry about. It's something that could affect you the rest of your life. So if you can prevent from getting it in the first place. Yeah.
I sure hope we reach somebody today, and I'm so glad that Mindy shared her story. And I know we didn't get to hear from Cindy. I know Cindy said she had Lyme disease, and she's doing well. So I just thank you guys all for being here. And Janie came. She lives in the woods. So Janie, I'm glad you came too. Thank you, Rock Hounding with Bigfoot. Nona Grace is here. Thanks, you guys. Casey, again, Evelyn, Mindy, Heather. Thank you guys for joining us. Amy Lou.
Oh, can I mention something? So rock hounding with Bigfoot said suggested to wear a hat. Not a bad idea, especially if you spray your hat with permethrin. And that would at least protect from getting in your hair, especially women. We have more hair, it's harder to see. So that's a great suggestion. Yes.
Awesome. Great stuff. Yes, socks and shoes. I'm actually going to go do it. I haven't done it this year. So, go pick this up, $7. You can probably order it online because I know we can't go a lot of places right now. But you don't want to have to go to the doctor right now. So let's work on prevention.
Yes,
Yeah.
definitely.
Well, thank you, Kelly, so much. I appreciate you.
Thank you for having me on. Oh, one more thing. If anyone wants more information about Lyme disease and know why it's so controversial with the doctors too, there is a great documentary called Under Your Skin. Actually, if anyone wants me to send you a copy through the mail, I can on DVD. It is also on YouTube. It's on Netflix. So Under Your Skin.
Awesome. I'm going to put all this in the box too. Kelly, you can help me with what we'll put in the chat box so people can have access to it.
Okay, yes.
Or the description box. Okay.
Mm-hmm. All right.
Have a wonderful day.
Too.
Thanks, Kelly.
Bye. Bye, everyone.
Bye. Bye, everyone.